Health authorities are investigating how unsterilised surgical instruments may have been used on 55 patients in the Hawke's Bay, exposing them to potentially deadly diseases. The patients, who include 3 children under the age of 16, will now be tested for HIV, hepatitis B and C, after a theatre nurse on Monday found a batch of equipment hadn't gone through the final sterilisation process. It will take up to 6 months for patients to find out if they're in the clear. The DHB says 18 patients who had operations at Hawke's Bay Hospital in Hastings are affected, as well as up to 37 others who attended dental or gynecological clinics between the 2nd and 11th of February. It is now investigating how the failure occurred. Dr. Colin Hutchison from the Hawke's Bay DHB is on the line from Hastings now. Doctor, can you tell us, you've said that the risk of infection is low, so statistically how low?
Yeah, it's impossible to put a statistical number on it, but the reason we have a multi-step process is for events such as this. And the 2 stages of cleaning that these instruments went through already, it's highly likely to reduce any chance of passing on any viruses to patients.
If you don't know the numbers, how can you classify the risk as low?
The experts both here within Hawke's Bay and nationally have said it's impossible to put a number or a percentage on the risk. The first thing to do is just to state that the fact that actually the chances of these instruments being used on a patient with a infection before the sterilisation process is extremely remote in itself, and that is the first thing that makes the chances of any of these patients being an actual risk very remote.
So given that you're saying that there's a low likelihood of infection, and you mentioned at the press conference that this could cause patients some high levels of stress, what thought did you give to not telling them about this?
Well, so we again took advice from our colleagues nationally about this, and it was down the straight basis that because we can't exclude any risk, we have to be, as an organisation, open and transparent, and we need to inform the patients we care for the mistakes that we've made and give them an opportunity to go through a care pathway that ensures that we're protecting them as best as we can.
But you did consider keeping the information from them?
No, we've just weighed up the risk versus benefit of causing unnecessary mental stress. And when we reached the point of that we couldn't exclude any risk to them, there was no thoughts about not disclosing this to the Hawke's Bay population.
So you've got 55 patients, 18 have been identified as having surgery at Hawke's Bay Hospital, and then you've got outpatient or out clinics that equipment went to. Why can you not track down those individual patients?
So in our main theatre block, literally every piece of equipment is tracked to a patient that has an operation, and that doesn't work in the context of an outpatient clinic where batches of equipment arrive in the clinic and then are used on a needs basis with a patient. And those different clinical healthcare practitioners aren't necessarily tracking it to an individual patient.
Isn't that a flaw in the system, though? Isn't that a flaw? What happened if something catastrophic happened and you had to track each individual piece of equipment, and in these outpatient clinics you can't? That must be a flaw.
Well, and that's why these events, as awful as they are so important to have those systems learnings from, because when we've gone out to our outpatient clinics, we've found that actually the dental patients, we can trace to individual patients, but in the gynae clinics we're not able to do that. And that's where, when we look for the system learnings from these events, the systems do change, both within the local DHB, but also national practices change based on these events.
So what, you're saying it's good because you've identified a flaw that you can now fix?
Well, whenever something adverse like this happens, it's really important to learn from it and look for opportunities to do things differently in the future to reduce future patients' risks as well.
So what out clinics did you send this equipment to? Whereabouts?
So they're all Hawke's Bay DHB outpatient clinics.
So what towns or places did you send them to?
So they're within the Hawke's Bay district. So it's our
specifically
doing.
Did any go to Wairoa? What other places did they go to?
Well, so I can't give the names of specific clinics for patient confidentiality.
I'm not asking you for patient names. I'm asking you for geographical areas, specific locations that you sent them.
The way that I'll answer that question is that we do have outpatient clinics in Central Hawke's Bay, in Napier and in Waira, and that's as much information as I can give tonight on that question.
And did instruments go to those 3 locations that you've just named?
I can't disclose that tonight.
Why not? It's not identifying any patients You said you're going to be transparent. Did you send them to those 3 locations?
Well, I wouldn't be able to tell you exactly what equipment went to which places, but what I can do is just reassure you that we've worked with all the clinics that our equipment has gone to, and we've ensured that those clinics have had all equipment recalled, and that where patients have been exposed to equipment that may not have been sterilised, they've been traced and identified.
So sterilisation is a multi-step process. It is the 3rd step that has been missed in this case. In simple terms, what is that step?
So that's the sterilisation process that uses a steaming process, and that process is a very robust final step to firstly disinfection stage, which is a very robust cleaning mechanism. All the equipment's then dried in a very hot dryer, and that drying process kills the majority of bacteria and viruses as well.
So these 91 instruments didn't go through that step. So was that a human error or is it an equipment failure?
So all of these things have multiple layers of safety checks, so undoubtedly there was human errors involved along the way, but this is a system failure that's allowed this to happen more than it being one person's responsibility.
I'm interested that a nurse discovered this, right? A theatre nurse discovered. What was the giveaway? I understand it's the label. The label should change colour when that final stage of sterilisation is done. And this nurse noticed that the colour change had not happened on the equipment, is that right? On the label?
That's correct. So the nurse that opens the theatre package is the final safety check before the equipment's used on a patient, and she noticed when she was using or going to use one of our big equipment bundles from that group that the equipment wasn't sterilised.
Okay,
and
so
what happens
here's the thing,
on those
Doctor.
Packages is they go from green to black, and that's why it's very obvious.
Green to black. Okay, here's the thing. These pieces of equipment were used in 55 cases. So why didn't the final stage, why didn't the final stage check get done in all those other cases? Why wasn't it picked up earlier?
So the big difference between the earlier ones and this one was that this was a large package with very highly visible markers that change. All the earlier cases were small packages where the markers weren't as clear. But at this stage, I'll be second-guessing of why those weren't picked up. They should be.
So now we've identified 2 flaws in the system. You cannot track individual pieces of equipment and their use on patients in our clinics, and you are telling me that labels on some of the equipment do not make it clear whether they have gone through the final sterilisation process. Correct?
So this is all what's going to be reviewed in our event review process, and I don't want to be second-guessing of where this has gone wrong.
No, but those are 2 weak points that we have just discussed.
Absolutely.
That's 2.
Two points that are already obvious to the group.
What other ones have you identified?
Well, we also just have to look at the mechanisms by which, as equipment's coming out the steriliser, why it wasn't obvious to the staff member removing the equipment, and that hadn't been through a full sterilisation process.
So can I just go back, I'm sorry to interrupt you, but can I just go back to the theatre nurses opening the equipment there and checking the labels? Does this not clearly suggest to you that those theatre nurses doing the final checks have not been doing them adequately?
Well, that's exactly what our event review would need to review of how this is occurred.
It seems pretty obvious, doesn't it?
I can't comment on that at this stage.
So why wouldn't they have noticed if they did the check and they checked the colour of the label and it had not turned to black, why would they not notice that?
So in the smaller packages, the change in the colour isn't from green to black. It's a softer change in colour, and we will need to do a review both here within Hawke's Bay and nationally to see if there's anything else we can do to make that more visible to the staff opening these smaller packages.
Okay, so Kevin Snee at the press conference said in the system there's always a number of fail-safe checks. So we've just identified 2 or 3 that have failed. How many others failed?
At this stage, we don't know.
How do you think that looks?
Yeah, well, look, I think this is where, as an organisation, we are being open and transparent. We've reached out to the patients as soon as we recognise there's a problem, and we're doing a rapid review process to ensure this doesn't happen again.
How can we possibly have any confidence?
Well, by the number of steps that are in process. So the first step is around the machine itself and the staff being made aware that we've had an issue with equipment coming out of the machine non-sterilised, and just creating visibility of this, rechecking.
But this short conversation that we have had has shown that your system has failed at multiple points and multiple times.
Yeah, and the only way an event like this occurs is if you have had a system failure at multiple different stages, because the purpose of having these robust mechanisms in place across a number of areas as safety checks is to avoid this happening. And this is why these events are so rare. And what we've had is we've had a number of fail-safes fail and just align in the wrong way.
Okay, thanks for joining us this evening. That is Dr. Colin Hutchison, who's with the Hawke's Bay DHB.